Hello, I am Kim Howard. I am Field Training Coordinator for Kentucky Autism Training Center. Today, we are going to talk about functional communication training. Thank you for joining me. We know that effective communication is critical for everyone. Take a few seconds and think about, why do we communicate? Why do we communicate? So, we communicate to request help or to gain information. We communicate to gain access to things that we want and need. I need a cookie. We communicate to inform others. For example, today we will be going to the store. We communicate to express emotions. I am so happy, or I am frustrated. We communicate to label things. That is a red truck. We communicate to comment. The Reds are having a great season. The average 18-month-old has been exposed to 4,380 hours of oral language at a rate of only counting 8 hours a day from birth. So in those first 18 months, they're getting over 4,000 hours of oral language exposure. A child who has a communication system or an AAC type device receives speech therapy, usually at best 2 times a week, maybe 3 times a week in some districts, for 20 to 30 minutes per session. So about an hour a week, best hope. They're going to reach that same amount of language exposure using their AAC device in 84 years. When I first saw this information, I thought, that doesn't sound correct. That can't be possible. But unfortunately, it does seem to be the case. We know that language users who are using AAC are exposed to much less language. We have to be robust. So we know that even if our speech therapist is excellent, they alone cannot be the sole provider of communication instruction and opportunities for our students that need those supports. We have to partner with them to provide many opportunities for a rich communication environment in the school setting. We have to partner with them to make sure that if we're in a family home, if we're parents, that we are providing opportunities in our home for our children to communicate with their device. And we need to be modeling that whenever we possibly can. Communication is the foundation for social skills, play skills, and academic skills. As a classroom teacher, I realized that if all of my focus was on academic skills, but not on how they would be able to communicate what they knew to me, or if my instruction on social skills left out important components, like how to ask for a break so that a child can self-regulate, I was missing the bigger picture of the whole child. We know that the average 3 to 4-year-old are going to be able to answer simple questions and ask simple questions involving who, what, when, and where. We know that probably they can make around 4-word sentences. For example, I go to school. They may have grammatical errors, but they can speak those simple sentences. And they should have between 250 to 500 words on average and tell a simple story. I tell you this information because I frequently see families and schools that hesitate to introduce AAC, or augmentative and alternative communication, because a child has some words, with the fear being that augmentative communication will keep them from developing their full speech abilities. I want to tell you that research tells us that augmentative communication can actually help build a bridge for some children to spoken language. And I've seen this in my classroom. Students that speak 10 to 25 words clearly, but they are 6, 7, 10, 12 years old. And think about it. If for the rest of my life I was only going to have 10 to 25 words, what words would I pick? It's almost impossible. If you think about the comparison of, I frequently am told, well, they have speech, and they do. That's 100% accurate, and that is wonderful. I'm so thankful that they have the ability to speak those words. But I'm hoping that through this this webinar today, you will be exposed to the fact that those are not enough words. We need to provide them with opportunities and access to be able to communicate more fully. And hopefully, augmentative communication can help partner to do that and give them options for being able to express themselves more fully. Basic conditions that we need for communication to take place. So we need at least two people who understand each other. We need a form, a way to send the message. Maybe that's spoken language, maybe that's an email. That could look a lot of different ways, and we'll go into more detail in the next slides. We need a content, something specific to talk about. For me, it's very close to summer vacation. I want to talk about vacation. Maybe we also need a function. So what is our reason and purpose to communicate together? Well, our purpose is to make plans together and talk about our plans on vacation. Pause for just a minute or a few seconds and think about what forms of communication have you used today? What are some of the different forms of communication? Well, it might be speech. It could be body movements or gestures. It might be facial expressions. It could be the use of an object or a symbol or picture symbols. It might be manual or sign language. No one form of communication meets all of anyone's needs or all social situations. If you think about, I am a hand talker. When I am speaking, I also make gestures with my hands. I'm using facial expression and body language. All of those go together as a part of our communication. When we are thinking about how to get started, or if we've been involved in teaching communication to a child or a student for many years, it's really important that the communication that we are trying to teach, whatever skill that we are trying to teach them in regards to language, it has to be motivating. They have to want to participate. It needs to be functional in that it gets their meaning and the words across that they are trying to communicate. It needs to be meaningful to the circumstances and the process of where they are at in their life skills and in their age currently. It needs to be based on the person's preferences. If I am trying to teach someone to communicate with me, and I personally like to talk about rocks, but the child or the student does not enjoy talking about rocks, but they very much enjoy talking about, I'm going to age myself here, bubble guppies, or they very much enjoy talking about Bluey, I'm going to be much better off, especially in the beginning, to talk about the things that they are interested in. And for some students or children, their preferences, the things that they will want to talk about it will always be very important, right? It will always be that high motivator, and it may take them a long time to be willing to speak about things that they are less interested in, even using AAC. So don't give up, right? Find out what is reinforcing to that student, what kinds of things do they like to do. If I'm thinking about this from my classroom perspective, I am looking for what kinds of things does this child gravitate to. If I turn them loose in my classroom and I'm not placing any demands on them or asking them to do anything, I'm thinking about what kinds of things do they go to. Do they go towards the block? Maybe they gravitate towards the iPad. Maybe there's a specific game there that we could start communicating about. Maybe it's a young or an early child, and maybe early childhood, maybe they gravitate towards the block center, and so maybe we could communicate about blocks. I'm not sure, but it's definitely something that I would want to consider and think about, so that this child or student is motivated to participate in the conversation. I'm not the one directing it as the adult. I am taking into consideration their needs and interest and where they are at in what age span and what part of their life they're in. Maybe there's some things that are more relevant to talk about. I have a student in the past that he liked to talk about food using his AAC. He very much was highly motivated to talk about food. He liked to watch chef videos. And it was a great place for us to bridge some of those communication pieces. And he was a willing communicative partner when we spoke about the items that he was very interested in. We know that there are barriers to supporting communication, even in the school system. When I was first in the classroom, even when I was many years into the classroom, there is limited training, especially pre-service. When I'm first graduating college and I was a fully certified teacher, there was very limited training on communication strategies for teachers. My assumption was that my speech therapist was the one who was trained. Only when I got into the classroom, I found out that most speech therapist training is very limited in the speech therapist functional communication training, or AAC type of training for them as well. So everyone is coming into the setting and there is limited training for on both sides. And as a teacher, as a person at large, you have to seek out opportunities like this one and many others that are out there to engage in conversations about communication and understanding some of the pieces and parts, the nuts and bolts that we all need in order for good functional communication to happen. Also, there's limited sharing. So if you are on the school side or on a professional side, then there is limited sharing of information sometimes between environments. So that home to school environment or school to home or the therapy center to school or home. We don't always bring everyone to the table and have a conversation about here's what we're doing. Let's get everyone around the table. Let's all kind of come at this from a shared perspective. So just even having good conversations about supporting communication can be a barrier. Time and resources and funding, definitely all of those are barriers. It can be very hard and time consuming to come up with items. And people have, I will tell you, some of the teachers that I have worked with have tried things and they didn't have instant success. And so they gave up quickly. And I will say, don't do that. Persevere, keep on trying, and knowledge of when to intervene and who should be the one intervening. Definitely can be a barrier. You want, like we talked about earlier, everyone wants, everyone's hope is that all children, all adults will have spoken language, but we know that that is not the case and that we have to figure out when is the appropriate time to provide interventions and what do those interventions look like. You might have 6 students who all need augmentative and alternative communication, or AAC, and they all look very different. So all of those things come together and form many barriers. We must model communication, and we have to make sure that the child has access to the communication system at all times. So as a family, if we are going out into the community, then that communication system goes with us. If we're going to the park or the beach or anywhere, our job is to look for opportunities to model that communication system and to have it out and present where that child is at or that young adult is at. So they are learning how to use this communication system and they see that communication happens everywhere. It happens in the car, it happens in the grocery store, it happens at the beach or the park, maybe it happens at a baseball game. Communication takes place everywhere, and in the beginning especially, we have to be modeling that communication system and using that communication system to show them how it works without maybe even the expectation that they are going to use it independently at this point. We are just showing them how it works and making sure that they know communication takes place everywhere. Today, we are going to talk about using functional communication training. Functional communication training is replacing a specific behavior with a more appropriate or a socially acceptable form of communication that achieves the same outcome. So for example, it is a child previously has cried and pulled on your hand to get access to a cookie, Instead, you would give them a picture card and teach them to access cookies by using that picture card. We're going to talk about that in depth today. One of the things that you have to do in order to complete functional communication training is you kind of have to know what is the function of the behavior. So the next few slides, we're going to kind of go through a brief look at how do we determine what the function of a behavior is and what can we do with that information once we have it. Antecedent behavior consequences. These are important terms and information to know when you're dealing with antecedent-based interventions. And as you can tell from the title, antecedent are interventions that we put into place before we have a behavior problem, right? So knowing this information will help you to decide which intervention, which pieces of antecedent-based interventions that you can put into place. It will also help you to know how to treat the behavior more effectively, hopefully helping it to stop or replace those behaviors with more effective, socially appropriate actions instead. So antecedent is anything that happens before the behavior occurs. The behavior needs to be specific details. What does this behavior look like? Don't tell me tantrum, tell me kicking and screaming, laying in the floor. What does a tantrum look like for your child? Tell me they were tapping their pencil on the desk. Tell me they refused to leave Walmart. Tell me those things. Consequences are anything that happens after the behavior occurs. Consequences could be things like I ignored the behavior, I carried my child out of Walmart as a parent who's had to do that. What happened? What specifically happened after the behavior occurred? So the example on the screen is a child is asked to stop playing on the iPad. The child screams no and refuses to stop. The parent shows them a first then board, which would be a part of antecedent-based interventions. And the first then board helps them to understand and communicate that iPad time can come back later. So the behavior resolves. So antecedent behavior consequences. And this is a in-depth piece of knowledge, I will just say, and we could go much deeper on this, but today is kind of a surface training. But it's a good place to start. It'll give you information that you need to know to help decide how to move forward in helping your child have more effective behavior that's socially appropriate. This is an ABC chart. This ABC chart will help us to collect some data. We need some information to help us make decisions about what the student is trying to communicate and what function of behavior that is serving. So ABC chart. This can be found out on, I found this on the internet many years ago. I love this particular one because it is checkboxes, which is so much easier when I am trying to process out and gather a little bit of information. If you don't like this particular form, you can simply Google ABC data chart or ABC behavior chart, and 100 different versions at least will come up. You can find a version that you particularly like, and you don't have to use one that has checkboxes. You can simply write ABC across the top of a paper and draw some lines on it and make your own chart. So however works best for you. This one I like because it has the checkboxes, which are very helpful. So this is the front side of it. In the A category, you're going to see things like check all that apply. So, and it gives you a reminder of the antecedent is what happened before. So what happened before the behavior? Maybe it was a difficult activity. Maybe someone told that child no, don't, or stop. Maybe they were moved from one activity or place or another. They had issues with transitioning. Maybe it was something about the absence of activities or toys. Maybe they had something going on. Anyways, lots of choices that you can choose. Check the boxes that apply. It has a place in the middle for the behavior, and it reminds you once again, the behavior needs to be specific. I tell people write that behavior in and then make photocopies. So I'm not writing a new behavior every time. If this is the specific behavior I am taking data collection on now, or you can leave that box blank and maybe you're seeing a lot of behaviors and you're having to change that up depending on what's going on in the moment. And then the last box is the consequence, and it reminds us that the consequence means what happened after the behavior. So what are some consequences that this offers? Maybe they were ignored by other children. Maybe they were given attention. Maybe the child needed to sit. Maybe they were removed from the activity or area. As you can see, there are lots of choices and things that might happen after a behavior occurs. Anyways, I like this particular chart. If you don't, that's fine. You don't have to use it. There are a lot of different versions out there, and you can find the one that fits you best. You just need to take enough data to be certain about why is this behavior occurring. What is the purpose of this behavior? And we'll go further into that. This is the back side of that same ABC data chart we were just looking at, and this is why I love it, is that on the back side, it offers suggestions of strategies that you might try to use. So change you means change the adult, right? Change the adult in the environment. Maybe you need to use positive language to tell the child what to do. Maybe you need to use visual supports to show the child the sequence of the activities. Maybe the adult needs to cool down and provide some cool down strategies. Maybe we need to add some of the child's interest and things that they like into the activity. Maybe they need a sensory or a movement break built into their day during this time, right? So a lot of options in that category, and you can read all of those yourself. In the change the child category, this means how are we going to support this child? So we need to teach the child some things. Let's teach them some new strategies. Maybe we need to teach them pause and think. Maybe we need to teach them a new skill with a scripted story. Maybe they need visual supports or some sort of sign to communicate, like functional communication or some other version of that, right? Maybe we need to teach children some options for problem solving under Change the Child. So the last category is change the consequence. So under change the consequence, we are looking at, do we give attention after they do the right thing? So we need to provide more positive attention. Maybe we need to do things like offer them a reward. We need to build in some sort of reinforcement for them. Maybe an adult needs to whisper to get the child's attention. Maybe we need to teach them some strategies like Tucker Turtle and sing to them to begin to redirect them. Maybe we need to build in a reward system or a social story or visual supports and reminders. So lots of options of choices that we can make directed at, are we changing the adult? Are we looking at changing the child? Are we looking at changing the consequences? This is my favorite part of this data collection sheet, is it gives you some suggestions and places that you can start. And you're not limited to these. You can absolutely add additional ones. So once we have collected that data, then we are looking for the function of the behavior. So what is the behavior telling us? Maybe the behavior is telling us that this is, and we use the acronym SEAT. Everybody takes a seat. We all have functions of behavior. Everybody's behavior comes back to some specific reasons, right? We all seek out sensory needs, right? Or automatic reinforcement. Sensory needs might be, I am self-stimulating. Maybe I am seeking out heavy work or deep pressure. Maybe my function of behavior is to escape the activity, right? Maybe whatever you're asking them to do right now is something that they do not want to do, right? And so if that is the case, then they have figured out that they can engage in some sort of behavior and they can escape. Because let's be honest, if you had to go to a work meeting and you could lay down in the floor and have a tantrum, scream, cry, kick, whatever that looks like for you, and your boss would say, you're having a bad day, let's go home. Why don't you go home today without any consequences of risk of losing your job? You might, right? Same for all of us. We all are seeking those things out at times. We all want to escape. Attention-seeking behavior. I want your attention. Positive attention or negative attention. Children do not know the difference. So if you're yelling at them, that is attention, right? If you're saying, oh, I love how you're sitting in the seat today, that is still attention, which are not always a bad thing, right? Maybe tangible is the other reason that behavior occurs. Tangible is the only one to me that's really can be confusing. Tangible just means anything that you can get or give, right? So an example of a tangible might be the iPad, a sticker, a popsicle, access to a walk, or it could be a tangible, could be access to the treasure bin or a favorite item at home. Lots of options there for what a tangible might be. We're looking at why might a problem behavior occur, right? So we're listening for the message behind the behavior. That hitting someone might indicate that they are trying to seek out attention and they don't know how to get access positively. Today, specifically, we are going to talk about the category of escape. This has came up a lot for many children and students that I work with, is that we need to give them a socially appropriate way to escape an activity. How can I get out of things, right? Being able to deny or ask for breaks are critically important. So that's the skill that we are going to focus on. So we are talking about replacement strategies. Functional communication training is essentially a replacement strategy. We just talked about antecedent, or the trigger of the behavior. We talked about the problem behavior, and we talked about figuring out what was our ABC, our antecedent, our behavior, our consequence. Now we need to figure out what behavior are we replacing, and we're going to replace that with an appropriate communication response. Okay, that's our goal today. We're going to replace it with a socially appropriate communication response because everybody needs those. All right, so other words and other scenarios that might be communicated via problem behavior, right? Maybe they are trying to get access to attention. So hi, notice me. Maybe I need help. So once again, that's access to attention, help. Maybe they are trying to reject something. So that is avoid and escape. Maybe it is what is that? Or I'm trying to get access to information. Maybe I want one, right? So I want a popsicle, I want a cookie. Maybe something is wrong and they are seeking out sensory access or escape. So all ways and things that we can use functional communication training and this contingency to help us figure out what our learners are trying to communicate to us. One of the things that I saw in my classroom was that my students that did not know how to ask for a break appropriately engaged in inappropriate behavior. I had a student flip a desk because when it was time to sit down and work, if he wanted out of the work, he had learned that flipping the desk helped him to escape that work behavior. And I had other experiences with many students that they needed an appropriate way to say, I need a break, and their communication skills did not have that in their repertoire, and so we had to work on it. So this is a couple of things that you need to think about when you are looking at replacement strategies. This is going to vary from person to person, right? Some students or children are going to use a button, maybe some sort of small AAC device that says, I need a break. Some are going to need a picture card. Some are going to use their high-tech augmentative communication device. You can use any version of that works for you. I'm specifically going to talk about it in picture card form, but you can use any version that works best for your child or your student, right? So any version that works for you. And the way that this works is your replacement behavior. So your problem behavior in my classroom was the child needed a break. And the problem behavior was that they flipped a desk. My replacement behavior that I taught was a picture card on the desk. And for them in the beginning, they may need unlimited access to breaks, which can be very controversial. People don't like to do that. But But I will say in the beginning that for some of my students, if they are engaging in frequent disruptive behaviors and I am teaching them this communication system, then in the beginning, I'm going to honor that and I'm going to give them access to a lot of breaks, which I know can detract from educational work time. My suggestion is that once they have had some experience with this, once you are able to move past the point of every time they ask for a break, then you have to honor that and give them a break. And my suggestion is their break be on a timer and be time limited, because if you don't set a timer, you will get busy and you will not remember to go back and have them be off of a break, right? You won't remember to go back and set them back to work or have them come back and work with you. You will get busy with someone else. So set a timer. Maybe their break time is 3 minutes. Maybe their break time is 1 minute. Maybe their break time is 5 minutes. It's going to depend on the student and the situation. In my classroom, when I first taught this, I taught this from the view of after those first few days, once they knew that they could get access to a break and they'd had lots of opportunities and experiences to ask for a break. Now, by asking for a break, when I first taught this, I had an adult stand behind them or beside them and prompt them to the card. So if I could tell that they were beginning to get frustrated, or if I could tell that they were beginning to build up anxiety, so maybe in their facial expressions, maybe in their actions, then I would prompt them by pointing to the card and saying, you need a break. Or some of my students would start to grab me, grab at my arms, and so when they would start to grab at my arms, I would redirect their hand to the card that said, I need a break. And then I would say, you need a break. And I would immediately get up and allow them to go to our designated break area in my classroom. And I would set a timer and I would say, all right, 3 minutes. And I would walk away, let them engage in their break. And then I would come back in 3 minutes and redirect them back to the work, redirect them back to their schedule. I'm collecting information during this time. Are there always activities that they reject? I had a student that we discovered through this process. He rejected activities that had a lot of handwriting in them. Handwriting was very difficult for him, and it made sense that he rejected those. So we adjusted, besides offering him the break card, we adjusted the work expectation. So instead of asking him to write 10 things in a sitting, we asked him to write 2. We didn't make writing go away because it was a goal for him, but we did adjust the expectations to where he did not get so overwhelmed, and eventually it helped him to reject them less often. And know that this can look like a variety of different things. It doesn't always, and you can use this functional communication training for many more words besides I need a break. You could use this for help. You could use this for everything in the world, right? I've used functional communication training to teach children to ask for a cookie, to teach them to ask for many, many different things. So you're not limited to just these words, but this is just today's example. And I need a break is such a need for many of the students and children that I'm seeing right now out in the world. And that's why that's why we're emphasizing it and highlighting it, is because kids need a way to get out of things. No matter where they're at, we all need a way to get out of things and to ask for a minute to engage in self-regulation. So for me, this is a key, critical, lifelong skill. So what might this look like at home? We're talking about a break card and we're trying to think through when a child might need to ask for a break at home. So take a minute, hit pause, and brainstorm for yourself. What are activities that my child needs a way to reject at home? When might they need to get out of something that they are not enjoying and they need a socially appropriate way to request to get out of it? So some of the ones that I came up with was maybe your family participates in home therapy. Maybe they need a way to ask for a break during that home therapy services. Maybe you have chores, which are all good things, right? But chores are not always enjoyable, and sometimes we need a way to ask for a break during them. Maybe you have a crowd of people at your house. Maybe you're having a pool party or a birthday party. Maybe it's Christmas and your child needs a way to ask for a break from being around everyone. So brainstorming through this can absolutely work in a home environment and a home setting. Just the reasons for the breaks would maybe be different. Maybe you do school at home. Maybe you absolutely do some school at home. I know during COVID, we all did some school at home. Maybe your child needs options to ask for a break if you're on a shopping trip or out in the community somewhere. We can take a break in a lot of different places, and this just gives us a way to access them in a more socially appropriate manner. So brainstorm and kind of think through what are times that my child has showed agitation, or we've had to leave activities early, or we've had to leave environments early and they needed a better way to tell me or to escape an activity. I need a break is a great way to do that. So you can absolutely use these same strategies for those activities as well. It doesn't have to be school-based. It could be a lot of different factors. You may still want help. And the other thing to think through is out in the community, if they're asking to take a break, well, what does that break look like? Am I going back to the car? Do we just move to a quieter area? I have a family that takes a break bag with them. They keep a small bag of sensory toys and a variety of activities, and they keep a camping chair. And if they're out at this past year, they went to a public fair with rides and carnival rides and those types of things, and they took a small chair with them, and when their child asked for a break using I need a break card, then they removed from the crowd. They moved to a shaded area that was a little bit quieter. They let them sit in the chair and gave them access to their bag of sensory toys and some of their favorite fidget type items. So what might an on-the-go break look like for you? Just some things to think through that might be helpful for your family when you're utilizing functional communication training, and specifically I need a break. You could use this for lots of other words. It doesn't have to be just I need a break. Functional communication training can be used for many, many words, but this is our example today. So let's look at other words that we might say with functional communication training. And you're not limited to any of these. You can use this for so many different things. Pause is especially good, I think, for many of the children and adults that we support, right? Pause is something that they're going to be familiar with because of the worldwide internet, right? Or video games, YouTube videos, watching movies, all of those, they may be familiar with hitting the pause button, going and doing something else, and then coming back. I've seen pause be especially effective for those learners that have a hard time stopping an activity and moving on to a new activity. So pause is a worthy consideration for using for functional communication training. I've had really great success with it, and I've heard a lot of good success stories. You can make your own pause button. I clipped a Google image. You can draw your own pause button, whatever works best for you if you're trying to make it into like a card. I keep some of these with me sometimes. Some of the circumstances that I have seen pause buttons be used is a student needs to move from one activity to another, so it's time to transition. They've been at center time and now it's time to transition to lunch. So if you're pausing something, you must be able to come back to it. That is the one factor that I would say. You don't want to teach anyone that if you pause something, then that means it just goes away. So just note that, but pause can be a very effective tool that can be used for a variety of learners. So something worth knowing about. So family thoughts for pause activities. What activities at home might you need to pause? So take a few seconds and think about where are times and places in our day that I would love to be able to pause an activity or pause something and then come back to it. Some of the places that I have seen these be used really effectively at home are pausing video games, right? There's a card. We've got to stop doing what we're doing right now, or a YouTube video. We're going to come back to it, but right now we're pausing it. And video games, those types of things have a natural pause, but some of our friends and some of our autistic learners need a visual support, so that pause card can be really effective there. I have seen these be used for board games, playing with toys, playing outside, and there are many, many other activities that you might potentially need to pause. Remember, we've got to come back to it if we pause it. So hopefully that same day or at a later time. But what might you need to pause at your house so that you could complete another activity and come back to it? I have seen these be used really effectively in the doctor's office. You're waiting in the waiting room, you're in the waiting area, your family member is on their iPad or on a device. You've been waiting for hopefully not long, but quite possibly you've been waiting for a little while, long enough to get deeply involved in whatever they are doing on their device. And now it's time to stop playing on that and walk into the back and go into the actual doctor's office. So I had seen pause be used for that. So we're pausing right now here in the lobby of the doctor's office, and then we're going to take it with us back. We've got to stop and walk back into the doctor's office, into the actual exam room. So I've seen it be used really effectively for that. And I know there are many other places that this could potentially be really helpful and useful to you. So think about times in your day that being able to pause an activity might be really helpful for your family member. Another word that we might consider for functional communication training would be help. Teaching our learners how to get and ask for help can be a critical life skill. If I am teaching this, I am going to set up scenarios and situations that the learner needs help, and I am ready and available to provide that. So in a school circumstance, maybe we're doing a craft and I don't give them the glue that they need. And then someone is there to prompt them to ask for help using a card, using their AAC device, whatever they're using. If I was at home, maybe I am we're having dinner and I don't give them a fork. Or maybe maybe the circumstance is I give them their plate, but I didn't put any chicken nuggets on it. And then someone is there immediately available to prompt help. So help is another good word that we all need. And there are many, many words. These are just some examples to kind of help you think through and to let you see. You can see on the screen that it shows the difference and shows the ABC. So that's the connection, right? And we talk about the replacement behavior, and that replacement behavior is this communication. So we're teaching them a communication response in order to replace that behavior. These are a few tips and reminders on how to help teach these responses. So set up a controlled time for the learner to ask for these things. If we're asking for a break, or if we're teaching the pause or help response in the beginning, you will have to have planned times to teach these in. Tell the student how to ask for a break, right? Tell them, have them out, model this. Earlier in this video, we talked about the importance of modeling AAC, modeling these alternative and augmentative communication devices or systems, whatever this looks like, even if it's a picture card. Model that for the student so that they see other people using it. Have extra adult help, right? In case a student or a child needs prompting to help reach for a card. In the beginning, when a student asks for a break, give them the break. If a child asks for the break, give them the break. Gather information about activities that they're trying to avoid. So if you're specifically teaching the break card, use that. I use that as information for me. What activities are they really seeking to avoid? Maybe I need to make adjustments and changes within those activities so that those activities are not so adversive to them, right? It's a data point for me to know what is happening here. How can I change my practice to help make this a better situation and circumstance for the learner? So just a quick information about a freebie that I found. You have to go and get that yourself. It is from the website that you can see on the screen, Autism Classroom Resources, Functional Communication Training. She had some break cards already made and has some other resources to help you get started. This is my email. You are welcome to email me with questions or concerns that you have. And I do try to respond. Just give me a couple of days sometimes to get back to you, but I will respond. And I hope you have a great day. Thank you for your time.
Thank you for watching this webinar. Please take a moment to complete the electronic evaluation by scanning the QR code or typing the URL in your web browser.